Is ADD, ADHD related to gluten exposure? Absolutely, it can be. That's not to say that everyone with ADD or ADHD has a gluten sensitivity, but it's definitely related. So if your child has that condition and you're looking at a Ritalin prescription, versus a diet change, diet change is a great place to start. Ritalin, all it really is basically it's legalized methamphetamine. I mean, it's a very potent drug and it suppresses children's growth. And I don't know, in my opinion, it's just not a smart thing to do if you haven't tried diet yet. Could you please touch on the effects of antibiotics on ulcerative colitis? That's a great question, Dahlia. So if you've got ulcerative colitis, it depends on why you have it. There are different reasons why a person can develop UC. It's an inflammatory bowel disease. And so sometimes as an inflammatory bowel disease, again, we're talking about ulcerative colitis. It's a form of inflammatory bowel disease, and it's oftentimes caused by an infection. So it can be, but it's not necessarily, doesn't have to be, right? So C. diff is one of the most common infections associated with ulcerative colitis. That's Clostridium difficile. It's a type of bacteria, and there's specific types of antibiotics that are designed to try to target C. diff. So if you've got ulcerative colitis, ask your doctor to try, basically they should be running some type of stool investigative test that rules out whether or not you have Clostridium difficile, because again, the key word of the day to take away is culture and sensitivity, right? If you culture and you have C. diff, then what kind of antibiotic is going to work effectively against the C. diff that you have? So this is an option. Now, what some people are also doing is they're doing basically they're doing rectal therapy where you're taking stool from a healthy individual and you're taking the bacteria from that stool and you're implanting it, right? You're transplanting it into the gut of somebody with ulcerative colitis, the bowels of somebody with ulcerative colitis. And so those types of therapies, again, this is a probiotic therapy, right? You're transferring healthy probiotic to that area, have also been shown to be very effective. But in my experience with people with ulcerative colitis, I actually have something that we use to help support these individuals, and especially if they're in a state where the diarrhea is super chronic. And that's a product called Ultrabiotic Defense. Again, what this is a very high dose, is a very high colony forming unit probiotic, which is rich in different strains, hardy strains of Bifidobacter and Lactobacillus. It's designed to support people with inflammatory bowel disease. So for many people, it helps to stabilize how many bowel movements they're having a day. But ultimately, with ulcerative colitis, you've got to find out why you have it. Now, C. diff is an infection that can cause it. Other infectious microorganisms can also cause it. Another trigger is gluten. Other triggers you can have food triggers, right? So, it just depends on why you have it. But if you're talking about, if you have it because of an infection, something like this can be very supportive of the GI tract. And you want to ask your doctor, talk with your doctor about using really high doses of Bifidobacter and Lactobacillus. Good question. What's the best antibiotic for repetitive UTIs if natural approach does not work? Culture sensitivity, Angeline, culture sensitivity. So it's not about which antibiotic is best. It's about which one works best for you. Remember, you could have a urinary tract infection, symptoms being exact in another person, but the bacteria that you have, even if it's the same strain of bacteria, might not have the same different antibiotic resistances. So it's about culturing. It's about getting a sensitivity test done, because the answer is very unique and very customized. Let's see, if you're exposed to COVID, is antibiotic, I'm not sure I understand your question fully, Christina. If you're exposed to COVID, is an antibiotic a yes or a no? Well, remember, COVID's viral infection. Antibiotics not going to really do a lot for COVID per se. Now, what happens sometimes to people in the hospital that have COVID is they pick up a bacterial infection because their immune system's, being overwhelmed. And so sometimes doctors in the hospital setting will prescribe an antibiotic along with other measures to treat COVID. But if you just have a relatively mild case of COVID and your doctor's trying to put you on an antibiotic, again, that's a question you want to have that conversation with them and talk about these things. Talk about these things with them, because it's not a yes or no so much as an answer as much as it is a unique individual need. That's true. I mean, Dr. Dentist, somebody's chiming in, Melly's chiming in, doctor, dentist, and veterinarian all want to give me and my animals antibiotics. It's kind of a cure-all or a catch-all cure-all for a lot of doctors. They tend to be really loose with the prescription pad, and that's unfortunate because, again, antibiotic side effects are not benign. They can be quite dangerous. Donna chimes in, Cipro is one of them. Yeah, Cipro is probably one of the most detrimental antibiotics that will damage your soft tissue, your tendons, your ligaments. So, I always say Cipro is like taking, if you've got a mild bacteria and you're relatively asymptomatic, you see what your body can do. Taking Cipro for something like that is like taking a cannon to a rabbit hunt. If you hit the rabbit, you're not going to have much meat left to eat, not if you hit it with a cannon. Let's see. Do antibiotics cause SIBO? Yeah, they can. Chronic antibiotic use can contribute to small intestinal bacterial overgrowth and imbalances. So yeah, they absolutely can. What do you take instead of antibiotics? And if you take antibiotics for whatever reason, what should you take after the antibiotics to get rid of the yeast? So again, I think I answered that question already. What do you take if you're taking an antibiotic? You want to make sure you're getting a really high dose probiotic to help support you overcoming that. As far as a fungal or a yeast overgrowth, one of the best things that you can take, we have another version for people that are dealing with chronic yeast to support them. It's called Biotic Defense, and specifically it has an ingredient called S. boulardii, and that S. boulardii can be very helpful at supporting the GI tract if you've got a yeast issue, if you're struggling with a yeast issue. There are a lot of natural antifungals that people like to take or gravitate toward taking as well. I mean, I have a number of products like caprylic acid and another one called Yeast Shield that work really, really well for supporting microbial balance in the GI tract. So those are all different types of options. Some people use oregano or uva ursi or different other plant botanicals to try to help restore some balance back to the gut after chronic antibiotic use causes a yeast overgrowth. Okay. Is there a link between the gut microbiome and fibromyalgia? Yes. Remember what I said earlier, Donald, about those gut bacteria being important for the production of serotonin. Serotonin is an important neurotransmitter for the regulation of how we perceive pain. And many researchers believe that fibromyalgia is not so much directly a disease that's damaged your muscles or joints as much as it's a disease of your brain not processing pain properly. And serotonin plays a major role in that. And there have been some compelling research studies that show the connection between serotonin disruption and fibromyalgic pain patterns. This is why some people do better when they take a drug like Paxil or Prozac, these SSRIs, the drugs that fall within that class, can sometimes be helpful for people that struggle with fibromyalgia. Now, I don't necessarily personally agree with using that as a long-term solution, but low levels of serotonin caused as a result of wiping out good, healthy flora can certainly be a factor. Yeah, Linda, I hear your frustration. Frustrated with doctors over always wanting to give the antibiotic for a sinus infection without doing a culture. I can't remember the last time somebody came to see me at my office where they had brought in a result from a prior doctor where they'd actually done a culture, and they may have been on 6, 7, 8, 9, 10 rounds of antibiotics over the last few years for chronic immune problems leading to that, and still nobody does anything more to investigate the potential of why that's happening. It's a frustrating world. We really do kind of live in a frustrating medical paradigm because most doctors, unfortunately, are so busy trying to see 30 or 40 people a day that they don't have time to see one person good, right, or well. And so it's a 5-minute appointment where they don't really have time to get your history, listen to you, really get your feedback. It's just an unfortunate paradigm we're living through. Let's see. So a lot of you with a history of repetitive antibiotics, antibiotics for acne, antibiotics for urinary infection, antibiotics for respiratory infections. Let's see here. What are my thoughts on newborns and infants and vitamin K shots? I'm not a big fan. There's a reason why newborn babies don't make the level of vitamin K. They're actually trying to, one of the things we do in hospital settings, unfortunately to babies, is we cut the cord way too early. And that cord pulses after the baby's born. It pulses because it's pumping nutrients into the baby's circulation. But it's important that the blood is a little bit thinner. And why is that? Because that blood that's pulsing from that cord needs to make it into that baby. We don't want to start injecting babies with vitamin K to increase their ability to coagulate the blood. We want their blood to be nice and thin. They're still at a point where that is an important thing. And I know a lot of people say vitamin K saves lives. I just don't agree with it. I don't think that you can justify, especially not the synthetic versions of vitamin K. Now, some people go more natural route, and instead of doing the vitamin K injections, they do oral vitamin K in their babies, and that's a possibility too. But my opinion of it is I don't like to see vitamin K used in mega doses in infants. I think God knows better than doctors, and that includes me. He knows better than me too, and so we've got to honor some of the natural order of things, and we've just kind of removed the natural order of things to such a great degree that we've lost sight of the forest through the trees. Antibiotics for an infected fingers. Doctors concerned it would go into the bone. First time I've been allergic, the idiots gave me Bactrim. It's a judgment call, Janet. If you've got an infection in your finger and it's bacterial infection, and their doctor's telling you we have really serious concern that this could become osteomyelitis or some type of bone infection, then an antibiotic's not maybe the wrong move. Again, that's going to be a decision that has to be weighed out between you and your doctor. You don't want to just do it just because, but at the same time, you also don't want to get an infection in your bone. I know sometimes it's a judgment call, and sometimes we make the wrong judgment call. Sometimes people make the wrong judgment call in that scenario where there's kind of more of an urgent or prescient need to potentially use it. And sometimes, side effects do happen. That's why with every drug, this is why we're having this conversation tonight, every drug has a risk benefit. What is the risk versus the benefit? What is the benefit versus the risk? Is the risk of a bone infection greater, right, than the benefit of wiping out an infection before it hits the bone? It depends on how aggressive the infection is, depends on what they identified, depends on how deep the cut is. I've seen people with scratches on their skin, and the doctors want to pump them full of antibiotics, again, just in case. But if you've got half a finger chopped off, it's not a bad idea to use an antibiotic to prevent the potential for a major infection to set in where you might lose that limb. So again, it's a judgment call. Let's see here. So Joe is asking, I had 5 antibiotics and paracetamol. That's another thing. So those of you that are not so much paracetamol, but those of you that use antibiotics with antipyretics, which are fever-reducing medications, so like aspirin or ibuprofen, they damage your gut too. So the antibiotic knocks out your good bacteria, knocks out your body, your stomach's and your GI tract's ability to produce the mucus lining that protects you. And then the non-steroidal anti-inflammatory compounds that. And this is another reason why lowering a fever combined with an antibiotic can spell an even greater degree of risk of side effects. So if you're trying to get back on track after 5 rounds of antibiotics, the best way to go about doing that is through eating very well, getting your diet super dialed in, super tight, and exposing yourself to good quality probiotics through both food and supplementation. Can bacteriophages replace antibiotics? I like that question. Thanks for asking it, Nathaniel. Bacteriophages, I don't know that they can replace antibiotics. There's some really great research on bacteriophages doing, wonders for fighting. Those of you who don't know, bacteriophages are types of viruses that actually combat bacteria. And so, for example, we have a product called Biotic Force that has bacteriophages in it, along with spore-based probiotics. And I've seen it work really, really well with people who are trying to support their overall health that way. But can it replace antibiotics? I think it depends on the situation. I don't know that we could really fully ever replace antibiotics in the case of acute care medicine, where somebody has a major infection and the risk of sepsis. I think antibiotics are the way to go. Don't try to take an oral bacteriophage supplement in lieu of antibiotic if your blood is turning septic. Let's see here. So what do we recommend for tendon and musculoskeletal recovery after antibiotic? I like that question because we've talked about that. Again, the Cipro, the fluoroquinolones, the class of medicines, the antibiotics that we know can cause it. One of the things I recommend is proteolytics, proteolytic enzymes. What do these guys do? They really support the inflammation process, but specifically around muscles, tendons, and ligaments. I use higher doses of these guys in people on a pretty frequent basis. We have a formulation, it's called Matrozyme, that's what it is it's a proteolytic enzyme formulation, very potent. So this is one of the things that can be done. The other thing I recommend is high doses of vitamin C. I use a product called Detox C for that. It's a powdered formula of buffered vitamin C, buffered with 4 different minerals to prevent any kind of GI upset. But 5+ grams per day, and you're trying to support the body's ability to recover from that tendon and ligament damage. There are other therapies that can also be done. Some people, and these are therapies more, so you go to the doctor, have them done, but cryotherapy can be very effective. Ultrasound therapies can be very effective tools at helping that type of damage. Cold laser therapies can be effective in that regard. So these are just some things that you can make an attempt at doing, both nutritional support as well as therapeutic support in that type of situation. Is it okay to be on doxycycline for 30 years? I don't recommend it. I think it's dangerous. I think it's a bad idea. An antibiotic for 30 years is not smart. Any doctor that sanctions that, I don't know, man, you got to question that. Run the other way, maybe. I don't know. If a lumbar puncture, that's an out there question. If a lumbar puncture shows negative for neurosyphilis, can you still have neurosyphilis? Yeah, a lumbar puncture is not the end-all be-all of the diagnosis. I would ask, beyond the lumbar puncture, I would ask for other types of tests, DNA tests from the blood. They can measure the presence of certain strains of bacteria, etc., through DNA analysis of the blood. They can also culture the blood. That might not be a bad idea if you're considering syphilis as the potential. But it also could be a misdiagnosis. If you may not have neurosyphilis, you may have the symptoms of neurosyphilis, which can be mimicked by other forms of neurological disease, and so it may not even be that. Let's see. Topical antibiotics such as polysporin. Well, from a topical perspective, if it's just a minor scratch or something, there are natural things that can be used. There's iodine, there's silver, there's a number of natural options that, in my opinion, would be, less aggressive, but just as beneficial or just as helpful. Is the number of strains in a probiotic supplement just as important as the number of CFUs? Depends, Christine. It depends on what you're talking about. It depends on it depends. in my products, we like to choose strains that we know can survive the stomach acid. That's one of the important factors for strain selection is, do these bacteria survive the acidic environment of the stomach so that they can get down lower and help to start colonizing? Are fermented foods okay if you have candida? Yes, they are, although some fermented foods I would not use if you have candida. For example, kombucha, which is fermented with sugar and still has sugar in it, is not something I would recommend as a fermented food product if you're struggling to overcome candida. But sauerkraut, which is a saltwater ferment, is perfectly fine. So again, kind of the key rule of thumb there, Mary, is use food ferments that are not fermented with sugar, but generally more so specifically fermented with salt and water. Let's see here. Let's keep going down. If you have high ochratoxin in A in body, should you avoid probiotics? No. No, there's no. Ochratoxin A is a mycotoxin. It's a mold toxin, so it doesn't mean you can't take a probiotic. I don't know maybe where you heard that, but no, there's no reason to avoid a probiotic if you have an ochratoxin A elevation. Keep going. So this is another good one on mold. So a lot of people's infections are mold oriented, and especially with the aging infrastructure of homes today and the water damage, etc. A lot of homes are mold contaminated, and then those are leading to immunosuppression and mold colonization of the sinuses, the upper respiratory tract. There's actually a condition called aspergillosis. Aspergillus is a common household mold, and if you've had water damage, sometimes it can get out of control and really create a problem. And so doctors, again, if they're not doing culture and sensitivity to help you to determine whether or not it's a bacterial versus viral versus fungal infection, you could be missing some key information, and so not getting better, but actually getting worse as a result of overutilization of antibiotics when it's not really the proper course or not the proper move to make. I think I answered that one already. Okay, so a lot of questions about the glutenology masterclass since I've got you live. The class starts on March 8th, so if you're not registered, I think we put a link up earlier to that class in the feed. We can pump that in again for those of you who are latecomers. It's a 14-hour masterclass. It runs from Monday to Friday, and it starts March 8th and it goes through March 12th. So if you're wondering when that's supposed to be, those are the dates. We had to push it back a few weeks because of the storm. So thanks for your patience on that. But at any rate, that's the answer. So let's see here. What else do we got here? Helene, how many billions of colony-forming units should you take of a probiotic on a regular basis? You know, it's not necessarily even an answer of how many billions. It's because probiotics can be obtained through diet and through behavior, right? How do we get probiotics? We get probiotics through gardening. We get probiotics through owning pets. We get probiotics through eating fermented foods. If you live in the city where you're, washing your hands with sanitizer, 15 times a day, going in and out. I know a lot of you with COVID are doing a lot of that. You're washing your hands to the nth degree. What you're really doing is you're stripping away your microbiome. You're stripping it away off of your skin. That's why also you're not supposed to take a shower every day. Showering every day strips away your skin-based microbiome, and it can, expose you to all different kinds of health problems. So in terms of how many billions you should take, my advice would be more specifically, try to get probiotics naturally within the confines of your behaviors and choices. And if you want to take like a daily probiotic, a good range to think about is about 40 to 50 billion colony-forming units is a good place to start. Rita's saying, 20 years ago, I had to take antibiotics for 3 years. Do I need to take probiotics for the rest of my life to repopulate my gut? No, not necessarily. Again, probiotics are commonly used in a setting where somebody's struggling with a health issue or struggling with a problem. But just because you have a history in the past, years ago, unless you're still struggling with symptoms, gut dysfunction, etc., doesn't mean you have to necessarily take a probiotic for the rest of your life. It's an individualized basis. It's not everybody needs it all the time, although there are certain groups of people I would recommend take it more often or more common than other certain groups of people. So for example, those of you with newly diagnosed gluten sensitivity or celiac disease, I absolutely recommend a probiotic because it's been shown, there have been a number of research studies that have been shown that it's important to get probiotics in those individuals, and that there's a benefit, that there's a direct healthy benefit to doing that. So again, but if you're already super healthy, do you need to take high doses of probiotics repetitively day in and day out? No, not necessarily. Okay. Let's scroll. Are certain probiotic strains more vulnerable to antibiotics? It depends. So that's a really good question. This is why culture and sensitivity, write that down, culture and sensitivity. I've said it 20 times tonight. That's how you know which antibiotic to have your doctor make the attempt at prescribing, is you culture and sensitivity. Because otherwise you're guessing, right? And when you have an infection, guessing, my opinion, if you don't have to guess, guessing is the wrong move, especially if you can get the objective data and not have to. Let's see here. What's the best natural option for me to get this all? So I have celiac, IBS, and now being treated for SIBO. What is the best natural option for me to get all this calmed down while it seems to be flaring up? Probably one of the best things you can do is follow No Grain, No Pain if you're not already. Those of you who are maybe new to the show don't know, but No Grain, No Pain is my international best-selling book. And you can get a copy of it in your local library. You can buy it at most major bookstores, but read it and follow phase 1 and get on phase 2 of the diet protocol. And that's a really good place to be when you're in a flare, trying to get it to calm down through your diet change. Zeolite, what do I think about it? Zeolite is an antifungal. Zeolite is not an antifungal. Zeolite is a binding agent. And it binds mold toxins, but it doesn't bind mold. It binds mold toxins. So, to be clear in the language, antifungals are substrates or substances that kill mold or fungus. A mold toxin is not a living thing. You can't kill it. So, again, zeolite is a binding agent. It has a really large surface area, and it can bind and help pull mycotoxins out of the body, but it's not an antifungal. Let's see. I think we're running out of time. I think we're probably over time here. We've still got like 50 questions in the feed here. We'll have to come back to them, folks. I gotta go home and eat dinner. It was great spending Monday night with you. Thank you so much for sharing your time with me. And look, make sure if you want to keep receiving this information, again, if you're new to the show and you want to come back and tune in more, we're here every Monday night at 6 p.m. Make sure you hit that subscribe button. Also, come visit me at glutenfreesociety.org. Sign up for our free newsletter. You sign up for that, we're going to send you a bunch of free gifts and information on how you can navigate the gluten-free diet successfully, how you can navigate the process of overcoming autoimmune disease successfully with diet and lifestyle. But also make sure, if you're not already signed up for my master class on gluten, it's free. There's no charge. It's 14 hours worth of information. I produced it just for you. I needed to create a comprehensive body to stop all the confusion. There's so much confusion out there about gluten. There's so much confusion out there about digestion and probiotics and antibiotics and all this information. So make sure you tune into that class, because I think it'll be invaluable for you to watch. Until next week, I hope you have a fantastic Monday through Friday. And again, we'll see you next time. Take care. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.